Hyperbaric therapies treat injuries by using pressure higher than local atmospheric pressure inside a hyperbaric chamber. Oxygen can be administered to help increase the amount of oxygen in the bloodstream. Hyperbaric chambers are typically pressurized to 1.5 to 3.0 atmospheres for 60 to 120 minutes once or twice a day. Oxygen passes down a gradient from high concentrations of oxygen to lower concentrations. Cells absorb oxygen as it passes by and through cell membranes, so the process requires available oxygen to be next to the cell. By increasing the amount of available oxygen on the outside of the cell, we increase oxygen crossing the cell membrane into the cell. Oxygen is transported in the blood by two mechanisms. It can be chemically bound to hemoglobin or dissolved in the plasma. Under normal circumstances, a very small amount is dissolved and most is bound to hemoglobin, which has an oxygen saturation of 97% during normal breathing. Breathing pure oxygen at 2 atmospheres causes the oxygen content in plasma to be 10 times higher than when breathing air at sea level. These elevated oxygen levels in the bloodstream cause a significantly greater amount of oxygen to diffuse into cells. Physiological effects of hyperbaric oxygen include enhanced oxygen delivery, reduced edema, phagocytosis activation, and anti-inflammatory effects because of enhanced leukocyte function. Angiogenesis or increased blood vessel development, osteogenesis, and collagen production by fibroblasts are all long-term therapeutic effects of hyperbaric therapy. We have seen people do very well in the chamber for various health and injury reasons, and it can be an excellent treatment option.